Okay, let's unpack this. Imagine you're looking at your dog and, well, something just isn't right.
Yeah.
Maybe they're suddenly listless, kind of hunched over, maybe refusing food, or they've been vomiting. Your gut tells you it's serious, but the signs are vague, maybe even a little confusing.
Yeah, that kind of situation where a dog has these non-specific but definitely concerning symptoms is precisely what this deep dive is about. We're looking at canine pancreatitis.
Right.
And as this source text we're focusing on highlights, it's actually relatively common, yet potentially very, very severe.
Exactly. And our mission today, just so everyone's clear, is to go deep into one specific source. It's a text titled Canine Pancreatitis, Basics and Treatment.
That's the one.
We're going to pull out the most important insights from this document so you can understand what pancreatitis is, at least according to this text. You know, which dogs might be more prone, what signs to look for.
How vets might diagnose it based on this info and the sort of core treatment strategies discussed.
Yeah, think of it as getting the need to know straight from this particular source.
Right. So let's jump right in. What does the source actually tell us about the condition itself? What is pancreatitis?
Well, the text defines it pretty simply as inflammation of the pancreas. And it points out right away, which I found interesting, that the cause is most often unknown.
Hmm. That's a key point itself.
It is. And it also distinguishes between two main forms, acute and chronic.
Okay, so acute, according to this source, is like an abrupt inflammation. It happens suddenly, usually with little or no lasting change to the pancreas itself.
Kind of pops up fast.
Yeah.
Yeah.
Whereas chronic, that's described as more of a continuous process.
Yeah.
The inflammation causes irreversible damage over time, things like scarring and shrinking. The technical terms are fibrosis and atrophy.
So acute is like a sudden fire you can hopefully put out, while chronic is more smoldering, causing permanent damage along the way.
That's a good way to put it.
So why does this inflammation, this internal fire, cause such widespread trouble in the dog's body? It doesn't sound like just a local issue.
No, and this is where the source reveals something really critical. Pancreatitis isn't just a localized stomach upset. The core problem it describes is the inappropriate activation and release of these really powerful digestive enzymes inside the pancreas itself.
Instead of in the intestine where they should be working.
Exactly. So
Yeah.
essentially the pancreas starts, well, digesting itself and the tissues around it.
Oh, ouch. That sounds, yeah, painful and damaging.
It is. And what the source really emphasizes is how this local problem triggers this whole cascade of inflammatory mediators. These things travel throughout the body, impacting multiple systems. It actually lists quite a few.
So it's definitely not just limited to the digestive tract then.
Oh, far from it.
Yeah.
I mean, yes, the gastrointestinal system is heavily involved. You get altered gut movement, potentially even widespread abdominal inflammation called peritonitis.
Okay.
But the source details effects elsewhere, too. It mentions the hepatobiliary system, that's liver and bile ducts, can suffer lesions from shock or enzyme injury. You might see fat building up in the liver or problems with bile flow. Then there's the respiratory system. It can be affected with fluid in the lungs, pulmonary edema, or around them effusion. And in severe cases, a really serious breathing syndrome called ARDS is possible.
That sounds serious.
It is. The cardiovascular system can show heart arrhythmias, possibly due to some substance released by the damaged pancreas, a myocardial depressant factor. And even the hematologic system, the blood system, can get involved. It can trigger the blood clotting cascade, sometimes leading to a dangerous condition called DIC.
Wow. Okay. That really underscores the potential severity. It can hit the lungs, heart, liver, blood clotting. This is clearly not just the runs or simple vomiting.
No, it's presented here as a truly systemic challenge for the dog's body. That's clear from the text.
Okay, so who does the source suggest is most susceptible? Are there, like, specific breeds or types of dogs more likely to get pancreatitis?
Well, the text notes it can affect dogs of any age, which is interesting. However, it's most commonly seen in middle-aged and older dogs, specifically those over 7 years old.
Yeah.
The average age for acute cases, according to this source, is around 6.5 years.
And what about specific breeds? Does it mention any?
Yes, it does point to a notable breed predisposition. It specifically mentions miniature schnauzers, Yorkshire Terriers, and Cocker Spaniels.
Ah, okay.
And it even discusses a possible genetic link in miniature schnauzers, something related to certain gene mutations, SPINK1, I think it was.
Huh. That genetic angle in schnauzers is a really fascinating detail from the source.
Yeah.
What about male versus female?
The text indicates a predominance in females, more common in female dogs.
Okay. And how common is it overall? Is this something vets see a lot?
The source describes it as a relatively common clinical disorder, and it gives a pretty surprising statistic, actually. Up to 1% of dogs without clinical signs might still have microscopic evidence of pancreatitis if you look closely.
Really? Even if they seem fine?
Apparently so, according to this text. And it's seen worldwide, no specific geographic limits mentioned.
So, given it affects different dogs and can have, varied severity, what are the key signs an owner might actually observe? What does this source guide us to look for?
Right. The text emphasizes that the signs are predominantly related to the GI tract. But here's the catch.
Hmm.
They're often non-localizing, meaning they don't immediately scream pancreas problem.
Okay, so vague stomach issues.
Pretty much. Abdominal pain is frequent, though interestingly, the source notes that dogs with the chronic form might not show obvious pain.
That's tricky. So what are the common things you might see?
Common historical findings listed are things like lethargy, just general sluggishness, a complete loss of appetite, anorexia, vomiting, which can be quite severe, general weakness, and sometimes diarrhea.
Okay. And if you take the dog to the vet, what might they find on a physical exam, according to this text?
The source lists severe lethargy as common, often along with signs of dehydration, from vomiting and not drinking. Abdominal pain is a really key finding.
How would they check for that?
Well, the dog might adopt that characteristic prayer position, front end down, rear end up trying to relieve pressure. Or they might just really resist any touch to their belly.
Okay, tensing up.
Exactly. Sometimes a vet might even feel something that seems like a mass in the abdomen, although that's less specific. Fever is pretty frequent in severe acute cases.
Right.
And then those less common but more serious systemic issues we talked about earlier, like difficulty breathing or signs of bleeding disorders, those can also be physical findings in some cases.
So the signs can really range from just sort of vague, sick dog stuff to quite specific physical discomfort, or even these very severe systemic issues. Given these varied signs and the fact you said the cause is often unknown, how do veterinarians actually figure out if it is pancreatitis, according to this text?
Yeah, that's the diagnostic challenge. The source highlights that these signs overlap with a whole bunch of other conditions that cause what vets call an acute abdomen. Things like a foreign body blocking the intestine, maybe internal bleeding, splenic torsion, even hormonal issues like hypodrenocorticism, Addison's disease. So vets need to rule those out.
Using various tests, I assume.
Exactly. They use things like blood counts, biochemistry panels, urinalysis, and imaging to start narrowing things down.
What do those standard blood tests typically show in pancreatitis, according to the source? Are there clues there?
Well, the text says a standard CBC, the complete blood count, might show signs of dehydration, like a high red cell count. It might show an increase in white blood cells, indicating inflammation, and sometimes low platelets.
Okay.
The biochemistry panel can show other signs pointing towards dehydration, like elevated kidney values, what's called prerenal azotemia. Often you'll see increased liver enzymes if the liver's been affected secondarily.
Right, from that systemic effect.
Precisely. Sometimes high bilirubin if bile flow is blocked, electrolyte imbalances from all the vomiting, sometimes high blood sugar in really severe cases, low protein levels, and often high cholesterol and triglycerides, hyperlipidemia.
Okay, quite a list. And the urinalysis?
Usually just shows concentrated urine because the dog's dehydrated, high specific gravity.
But crucially, none of those findings are absolute proof it's pancreatitis, right?
Exactly. And this is a really crucial point the source makes. The standard serum amylase and lipase levels, even though they're pancreatic enzymes, they are not reliable as specific markers for pancreatitis in dogs.
Wait, really? I thought those were the main pancreas tests.
That used to be the thinking, but this source is clear. They can be elevated for lots of other reasons, like kidney issues, other GI diseases, even certain medications like steroids can bump them up without the dog actually having pancreatic inflammation.
Okay, so that's a major takeaway. Don't rely solely on amylase and lipase. So what are the specific pancreatic tests this source emphasizes?
This is where the source highlights the importance of something called serum pancreatic lipase immunoreactivity, usually shortened as CPL.
CPL.
It's described in the text as a highly sensitive and specific blood test, specifically for acute pancreatic inflammation. It's measuring a pancreas-specific form of lipase.
Sensitive and specific for acute cases. What about chronic?
The source notes it's less sensitive for chronic cases, but for acute, it's presented as the key blood marker.
I think I've heard of a quick test vets can run right in the clinic. Is that related to CPL?
Yes, exactly. The source mentions the SNAP CPL test. It's a useful, quick screening tool. You can do cage side right there in the
It
clinic.
gives you a quick idea.
Right, but it's basically a yes or no kind of answer. Is level potentially elevated or not?
Yeah.
The text stresses that if that SNAP test is positive, you should really follow up with the quantitative spec CPL test.
Spec CPL.
Yeah, that's run by an external lab, and it gives you an actual numerical value. It's considered the more definitive serologic test mentioned in this source for confirming and maybe getting a sense of severity.
Okay, so SNP for a quick screen, spec CPL for the more definitive number. That makes sense.
That's the process outlined in the text.
Hmm.
And beyond blood work, imaging also plays a really key role.
Right, you mentioned imaging, x-rays, ultrasound. What does the source say?
Abdominal radiographs X-rays are actually less useful for seeing the pancreas itself, the source notes. Their main value is more in ruling out other causes of vomiting, like, did the dog swallow a toy?
Ah, okay. Looking for blockages and things.
Exactly. X-rays might show some subtle, non-specific changes that suggest inflammation in the area where the pancreas sits, like maybe some haziness or altered gas patterns, but they aren't considered diagnostic for pancreatitis itself, based on the source.
So ultrasound is probably better.
Much more detailed, according to the text. Abdominal ultrasound can actually visualize the pancreas. The sonographer can look to see if it's enlarged, if its texture or echogenicity is abnormal, if it looks irregular.
What else can it show?
It can show inflammation or fluid around the pancreas, check for complications like abscesses or those pseudocysts we might talk about later, check the bile duct for obstruction. It gives a much better view of the pancreas and its neighborhood.
And does the source say anything about combining tests, like using both blood tests and ultrasound?
Yes, absolutely. This is another major diagnostic insight from this document. The source specifically states that the CPL assay, the SPEC CPL test, combined with a pancreatic ultrasound, offers the highest sensitivity for diagnosing acute pancreatitis while the dog is alive, an ante-mortem diagnosis.
So that pairing CPL plus ultrasound is really the gold standard according to this text.
That's what it points to for the best diagnostic accuracy in living patients.
The source also briefly mentioned biopsies, right? Is that common?
It does mention them. Things like an ultrasound-guided biopsy or getting a sample via cytology looking at cells, or even surgery like laparoscopy or laparotomy to get a tissue sample for histopathology. These can definitively confirm inflammation.
But probably not the first step.
Usually not, unless maybe ruling out cancer or something else. The source does add a little caution, though. Sometimes histology, the microscopic exam of the tissue, can actually miss the diagnosis if the inflammation is only in small patches, what they call focal lesions.
Okay. So recapping the diagnosis based on this text, it involves looking at the clinical signs, ruling out other serious problems using general tests and maybe x-rays, and then zeroing in with that specific CPL blood test, ideally backed up by an abdominal ultrasound.
That's a good summary of the diagnostic approach described.
So once it is diagnosed, how does the source guide the treatment? What's the plan?
Well, the source states pretty clearly that most cases are going to require inpatient medical management. That means hospitalization.
Okay, not usually treated at home then.
Not typically for acute significant cases described here. And the primary therapy, the real cornerstone recommended, is aggressive intravenous 5V fluid therapy.
Fluids. Why are 5K fluids so critical? What are they doing?
The source explains their role is really twofold. First, obviously, to correct the dehydration and shock that often comes with the vomiting and lack of intake.
Right.
But second, and this is crucial, it's to maintain healthy blood flow, good perfusion to the pancreas itself. Keeping that microcirculation going is thought to help limit the ongoing damage and promote healing.
Ah, okay. So fluids are helping the pancreas directly too.
That's the idea presented. The text suggests a common balanced fluid choice, like lactated ringer solution, LRS, as a good first option. And it outlines how vets need to calculate the significant fluid needs, replacing deficits, covering maintenance, and accounting for ongoing losses from vomiting or diarrhea.
Sounds like a lot of fluid.
It often is. The source also mentions that sometimes colloids, special fluids that help keep fluid within the blood vessels, might be necessary in some severe shocky cases.
Okay. Anything else with the fluids?
Yes, potassium. Because dogs often lose a lot of potassium through vomiting, supplementation with potassium chloride, KCl, in the IV fluids is usually needed. The source gives guidance on monitoring levels and safe infusion rates.
Got it. Fluids are number one. Any other foundational care mentioned?
Activity restriction is advised. Basically, strict rest is needed for recovery. Cage rest, usually.
Okay, that makes sense. Now, diet. this seems to be a point where treatment approaches maybe have evolved over time based on what this source is emphasizing.
Yes, this is a really critical insight from this source, and honestly, it might be surprising to some owners. The text strongly advocates for continuing to feed the dog orally by mouth if the vomiting is not completely uncontrollable.
Wait, hang on. Feed a dog with an inflamed gut and pancreas. That feels counterintuitive. Shouldn't you rest the gut?
It does feel that way, doesn't it? That was the old thinking NPO, nothing by mouth. But this source explains the rationale behind the shift. Continuing to feed, even small amounts, helps maintain the health and integrity of the intestinal lining. It provides nutrients to the gut cells themselves. Okay. And it may also reduce something called bacterial translocation, basically, preventing bacteria from moving out of the gut and into the bloodstream, which can worsen those systemic issues we talked about.
So feeding actually helps protect the gut barrier and prevent wider infection.
That's the reasoning provided. Now, if the vomiting is truly severe and persistent, then yes, the dog is kept NPO, nothing by mouth but the source stresses, for the shortest time possible, usually aiming for maybe 12-24 hours without vomiting before trying food again.
Okay, shortest time possible for NPO.
Yeah.
Then how do you reintroduce food?
Very cautiously. You start with small amounts of water first. If that stays down for a bit, then you try small, frequent meals. The source recommends starting with easily digestible carbohydrates like plain boiled rice.
Just rice.
To start. If that's tolerated, you gradually add a very lean protein source. The examples given are things like low-fat cottage cheese or boiled white meat chicken, skinless and boneless, obviously. Small amounts, maybe 4 to 6 times a day.
Got it. Start simple, low-fat, small meals. And what's the longer-term or ongoing dietary guidance from the source? This seems important.
It's presented as crucial. The source is very firm here. You absolutely must avoid high protein and especially high-fat diets. These are thought to stimulate the pancreas excessively.
So low-fat is key.
Definitely. They recommend specific fat-restricted, low-residue prescription diets for recovery and potentially for long-term management, especially if the dog develops chronic pancreatitis or has recurring episodes.
Okay.
The source also mentions using feeding tubes like nasogastric or esophageal tubes as an option for providing nutrition if the dog absolutely won't eat orally or if vomiting persists despite anti-nausea medications. But the preference seems to be oral feeding if possible. This focus on carefully controlled, low-fat feeding is a major treatment takeaway.
Okay, so recapping treatment so far based on this text, aggressive IV fluids, rest, and very specific low-fat dietary management, ideally feeding orally if possible. What about medications? Pain relief must be important.
Absolutely essential. The source stresses this is a painful condition. It lists options like buprenorphine, which is an opioid, or even a continuous rate infusion, a CRI, of fentanyl for more severe pain. Good pain control is vital.
Okay. And for the vomiting?
Antiemetics, anti-nausea drugs are definitely needed if vomiting is happening. The source suggests options like meropitant, which is Cerenia, or ondansetron, Zofran, things to help control the nausea and vomiting.
What about anti-inflammatories like steroids? Is that helpful for the inflammation?
That's an interesting point in the source. It mentions that corticosteroids like prednisone or dexamethasone are indicated only if the dog is in shock.
Only for shock?
Yes. But it explicitly states that, as of when this text was written, published evidence for their benefit in treating general acute pancreatitis, just the inflammation itself, is lacking. So not standard treatment unless the dog is in cardiovascular shock.
Okay, that's good to know. And antibiotics, you mentioned infection can happen. Are they standard?
This is another crucial distinction the source makes. Antibiotics are only indicated if there is clear evidence of secondary bacterial infection or sepsis.
So not automatic?
Definitely not.
Yeah.
The source lists examples if infection is suspected or proven, like penicillin G, ampicillin, or maybe enrofloxacin, depending on the situation. But it includes a very specific warning, basically saying only use antibiotics if a clear clinical condition exists, such as infection.
Right. So don't just give them just in case.
Exactly. That's the guidance here. They are not considered a standard part of uncomplicated pancreatitis treatment unless infection is confirmed or highly suspected based on clinical signs or tests.
This brings us to something else the source highlights as really critical. Are there specific drugs that should absolutely be avoided in a dog with pancreatitis?
Yes, and this is vital information for owners to have straight from this text. The source lists specific drugs that are considered contraindicated.
Meaning they absolutely should not be used.
Correct. Because they could potentially worsen the condition, or in some cases are even suspected of potentially causing pancreatitis in susceptible dogs.
Wow. Okay, what's on that list?
The list provided in this source includes anticholinergics like atropine, the immunosuppressant azathioprine, a diuretic called chlorothiazide, estrogens, another common diuretic furosemide, Lasix, the antibiotic tetracycline, and the chemotherapy drug L-asparaginase.
Hmm, that's quite a mix of medications. Some are pretty common.
They are. So it's really important, based on this source, for owners to be aware of these, especially if their dog has had pancreatitis before or might be considered at risk. Definitely something to discuss with your vet if other conditions require medication.
That list is definitely something to file away. Okay, what about surgery? You mentioned it briefly for diagnosis, but when does the source suggest surgery might be needed as part of the treatment?
Right. Surgery isn't usually a primary treatment for the inflammation itself, according to this source. It's typically reserved for managing specific complications if they arise.
Like what kind of complications?
Things like pancreatic pseudocysts, which are like walled-off fluid collections, or pancreatic abscesses, which are pockets of infection. Also, if there are areas of dead pancreatic tissue necrotizing pancreatitis that need to be surgically removed, debrided, or if the swollen pancreas is physically blocking the bile duct, surgery might be needed to relieve that obstruction.
So, complications mostly.
Yes, or potentially if the diagnosis is uncertain and the vet needs to surgically explore the abdomen to rule out another surgical emergency that might be mimicking pancreatitis. But for uncomplicated pancreatitis, it's primarily intensive medical support.
Got it. So, primarily medical support focusing on those pillars: fluids, pain control, careful feeding, avoiding those specific drugs, with surgery held for defined complications. How does a source talk about monitoring the patient during treatment, follow-up, and, the overall prognosis?
Close monitoring during hospitalization is emphasized, especially in the first, say, 24 to 48 hours, when things can change quickly.
What are they monitoring?
Things like hydration status, physical signs, attitude, pain level, vomiting, body weight, key blood values like the packed cell volume, hematocrit, total protein, electrolytes, kidney values, blood sugar. And urine output is important too, to ensure the kidneys are working and the fluid therapy is effective.
So, constantly evaluating how the dog is responding.
Exactly. Fluid therapy needs constant evaluation and adjustment based on the patient's status. The source also specifically recommends repeating that SPEC-CPL test after about 7 days
Why after 7 days?
to assess how well the pancreatic inflammation itself is resolving and how the dog is responding to the treatment. It gives an objective measure of the inflammation. And, of course, watching closely for the development of any of those systemic complications is key throughout the monitoring period.
Okay. Is there anything mentioned in the source about preventing pancreatitis from happening in the first place, or preventing it from recurring if a dog has had it once?
The advice from the source on prevention is actually quite straightforward and practical.
Like what?
If the dog is overweight, then weight reduction is important, as obesity is listed as a risk factor. Strictly avoid feeding high-fat diets or high-fat treats. That seems to be a major trigger. And obviously avoid administering those drugs that were listed as potentially causing or worsening the condition, if at all possible.
So, weight control, low-fat diet, avoid risky drugs.
It's-
Seems sensible. What are the possible complications mentioned in the source if things don't go smoothly?
Well, the main ones include just a poor response to the initial supportive care. The dog just doesn't get better. Or the development of those severe life-threatening systemic conditions we discussed earlier, like DIC or ARDS.
Okay.
And another possibility is that an episode of acute pancreatitis might unfortunately progress and lead to chronic pancreatitis, that ongoing smoldering inflammation.
Right, the long-term damage. Given all this complexity, what does the source say about the expected course and the overall outlook? Is it generally treatable?
The prognosis described is generally good for most dogs with uncomplicated acute pancreatitis if they respond well to that aggressive initial supportive care, the fluids, pain meds, diet.
So prompt intensive treatment is key.
It seems so. However, the outlook becomes much more guarded or even poor for dogs who develop the more severe forms, like necrotizing pancreatitis where tissue dies, or those who develop significant systemic complications. Those cases are much harder to manage successfully.
Okay, so let's try and bring this all back to you, the listener. We've really done a deep dive into this specific source text on canine pancreatitis today. What are some of the key insights maybe to walk away with?
Yeah, I think first is just realizing what it is, an inflammation of the pancreas, often with no known cause that isn't just a simple tummy ache. It can potentially affect multiple body systems, which makes it serious.
Right. And understanding that while the signs can be vague, this source points to specific factors like certain breeds being middle-aged or older, or maybe being female, that seem to increase risk.
Exactly. And crucially, the diagnosis, according to this text, really relies not just on general sick dog blood work, but on those specific tests, like the CPL assay, ideally combined with an abdominal ultrasound. That combo is highlighted here as having the highest sensitivity for acute cases.
That's a big one. And the treatment approach, based on this text, it's fundamentally supportive, isn't it? Aggressive fluid therapy is absolutely paramount. Managing pain is essential.
Yeah.
And that's seemingly counterintuitive, but really important strategy the source emphasizes. Feeding a low-fat diet orally, if possible, rather than strict NPO to support gut health.
That's a key takeaway on management. And also knowing that specific list of contraindicated drugs the source provides, that's vital information you should be aware of and potentially discuss with your vet.
Absolutely. So hopefully this knowledge from the source empowers you a bit. If your dog is ever diagnosed with this, you have a better understanding of the complexity, maybe why the vet is ordering certain tests, why hospitalization is often necessary, and why managing that diet so strictly is really, really critical.
It helps you be a better advocate for your dog by understanding the why behind the vet's plan based on this kind of information.
Definitely. Considering how many different body systems can potentially be impacted by just one inflamed organ, the pancreas, and how often, according to this text, the exact trigger remains a complete mystery. It really underscores how incredibly complex and interconnected our dog's internal workings are, doesn't it?
It really does.
It makes you think about how delicately balanced their systems must be, and how something going wrong in one small place can have such far-reaching effects.